Good day. Welcome to the Daily Dose. My name is Wendy Darlin. I work exclusively with allergists, specialists wanting to make more money, use effective tax strategies, and keep more of that hard-earned cash. And today we have with us Nancy Latati of Latati Physician Strategies. Nancy is the expert, in my opinion, on converting to a concierge practice and setting yourself up for success. And today we're going to be talking about concierge as it relates to allergy. We have seen a huge growth in concierge practices across many specialties, but we're not seeing it in the allergy market. And this is curious to me. So my question is to you, what's holding you back? Nancy's going to answer some of your questions, and I welcome your feedback. Nancy welcomes your feedback. We want to know, why is the allergy community not jumping on this opportunity to go concierge? So welcome, Nancy.
Thank you. Thank you, Wendy. Thank you for having me on. So let me speak to that. I think the main thing is that until people see other people doing it, it's hard to follow suit. And so somebody's got to be in that first crowd. When I have looked online to see who is doing it, I'm not really finding much, but I do think there's a tremendous opportunity, so I can speak to what the opportunity might be. And I think, and I actually want to bring lifestyle medicine into this conversation too, because I actually think that's where the opportunity lies. So rather than see somebody, several times a year, send them off with a prescription, do an evaluation, treatment plan, prescription, there's so much opportunity for those who really want to be able to spend more time with patients to come up with some lifestyle modifications, teach them how to deal with their allergies, how to minimize the effects through lifestyle management. So nutrition is a great example of that. How do you eat differently? And that's not just something you can tell patients to do. So you really need to have a structure in the practice. So what I would advise is I think the opportunity is there. I do think, though, that it's probably best, until we see how this model gets proven out over time, and I think we will, to test the waters with a hybrid model. And oftentimes I don't recommend that. I think it's better just to jump in completely. But in this case, I think it's a wise strategy to offer a program that is not required, so patients can opt into a membership program. And that can be for high utilizers, maybe asthma patients, eczema patients, people with seasonal allergies that, are coming in several times a year. Probably could come in even more often, or want to be able to contact the doctor. So, so I think that's really, where you're teaching, coaching, maybe doing some cooking classes or teaching.
I love that idea. That makes you part of a community, and that's what we're really all looking to do. And what would you say would be the first thing to do? So if there's someone listening right now who goes, interested, maybe this is for me, what would you say the first step would be?
Yeah, so a couple first steps. One is to figure out, what can you do if you had more time with patients? And that's probably the biggest question in any concierge practice. What would you do if you had an hour to spend with a patient, with all your patients? What could you do? And that's where, lifestyle medicine is a great example where you really need time to do that. And then what is the value of that? And so once you can place a value on it, then you can have something to offer for a fee.
Right.
It's important to do a market analysis and some basic business planning. Understand your current practice, understand the overall market, figure out what the financial picture would look like if you were to, create more time for patients, so you couldn't see as many of your regular patients, but you would have a fee to offset the extra time you're spending with patients. What would that pricing look like? What would that value look like?
Right.
And also look at the competition and see, how would you be differentiated from another practice? And I think that's really a key in terms of asking people to pay a fee. It's like, you can get XYZ services anywhere, but if you want the services I can provide, there's nobody else doing that. And that's why I'm carving time out and I'm charging a fee for that.
I love it. That's where the profit piece comes in, and I
Absolutely.
talk
Yeah.
about all the time.
Absolutely.
And it also takes us away from the traditional billing model. And that being said, there are a lot of myths out there, a lot of things we hear via the grapevine of what's going on in the concierge market. Are there pitfalls, any myths that you can dispute today that can have our listeners perhaps realize that this is not the big, scary, angry bear that some of the competition are portraying it to be?
Yeah, yeah. Well, I think, the practices that do well as concierge practices aren't just like sending a letter out to patients and making a few changes on their website. I don't think that breeds success. And that gets back to my point about planning and really thinking through, like, what is it you can do? Who's your market? How do you price it? How do you communicate it? How do you bring this message to your patients so that they see the value? That's all very important information. And also to look at the financial piece and make sure it's going to make sense financially, because you don't want to kill your business or run it into the ground. So that's really important, to look at the financial picture before you test it out with your patients.
That's great. And I like your idea of a hybrid model, because I think for those people out there who are nervous to be the first to path with us, doing a hybrid model allows you to get some traction in that area before you do it all in.
Exactly.
Thank you, Nancy. I really appreciate your feedback, your help today. If anybody's interested in contacting Nancy, what's the best way to reach you with any questions, Nancy?
Best thing to do is go to my website, and you can go to the contact page and reach out to me through that contact page, latatips.com. And you can just reach out to me directly there. My phone number's there. My email address is there. So I'd be happy to talk with anybody who's thinking about it, has some initial questions, exploring it, anything we can do to promote this great way of practicing medicine.
I love it. Thank you so much. And to add that, we also welcome the negatives of why you don't want to do this, because that will help us understand why it's not taking traction. And if we are to find someone that it's going to work with, and we're helping them through the system, the downfalls as you as practitioners see. So we welcome your feedback. I am Wendy Darlin, the Profitable Allergist. You can find me at www.aboutprofit.com. Thank you, and goodbye from the Daily Dose.